Hi, you guys. Welcome back for our daily practice questions. It is day 45, and as always, I like to first get into my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey, y'all. For those of you who are new here, welcome, welcome, welcome. I'm Dr. Brittany Weinstock. I am a family nurse practitioner, and I am the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, digital flashcards, Q banks, one on one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. Now, y'all know my disclaimer and reminder is that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any of the questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AAMP exam. Now, any of my videos where you see that I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number one for today. Oh, and let me not forget, happy Valentine's Day, you guys. All right, question number one. A 72-year-old male presents with complaints of pain and cramping in his calves when walking short distances. He has a history of diabetes and hypertension. On exam, his legs are cool to touch with weak pedal pulses. The skin appears shiny and thin with a bluish tint. The patient mentions that the pain is relieved with rest, but the symptoms return with the ambulation. What is the most likely diagnosis based on this patient's presentation? Is it A, chronic venous insufficiency? B, peripheral arterial disease, C, DVT, or D, cellulitis? Take a moment and tell me what you got in the comments, y'all. All right, so I always recommend reading the stem of the question first, as it allows you to slow down to ensure you're answering what is even being asked of you. Don't get so caught up with reading it standard and all of the fluff and causing yourself to go down a rabbit hole that the question may not even be asking. So take that time, read the stem first, and see what you need to address, okay? So the stem of the question here states, what is the most likely diagnosis based on this patient's presentation? All right, so y'all know, I tell you, if it's asking for a diagnosis, we need to run it back and look at those assessment findings, right? So we have a 72-year-old male that came in, complaints of pain, cramping in his calves when walking even short distances. He has a history of diabetes and hypertension. And on exam, his legs are cool to touch with weak pedal pulses. His skin appears shiny and thin with a bluish tint. And he mentions that the pain is relieved with rest, but the symptoms return once he's ambulating. All right, you guys. This is classic for peripheral arterial disease. So B is your best answer, right? Remember what we talked about on yesterday's video. So he's having cramping and pain, in the calves when walking short distance. Claudication, you guys. That's claudication. He has a history of diabetes and hypertension, classic conditions that can cause vascular issues, causing issues with the blood flow, which is what is going on with peripheral arterial disease. The arteries are unable to adequately bring blood down to the lower extremities. So as we're walking and causing a increased blood flow where there's lack, we begin to have pain or discoloration. Lack of blood flow can cause coolness to touch, right? Weak pulses, all of the things. Classic, classic, classic. B is your best answer for PAD. All right, question number two. A 55-year-old female presents with swelling and heaviness in her legs, particularly in the afternoon. She has noticed that her lower legs are often discolored with a brownish hue around the ankles. She has a history of prolonged standing as a teacher. On exam, you note bilateral leg edema and varicose veins. No significant pain is reported, but she states that her symptoms are worse by the end of the day and improve with leg elevation. Which of the following is the most likely diagnosis for this patient? Is it A, PAD? Is it B, CVI? Is it C, lymphedema? Or is it D, acute arterial occlusion? Take a moment to tell me what you got in the comments, y'all. All right, so similar question here states, which of the following is the most likely diagnosis for this patient? So again, they're asking for a diagnosis. We want to run it back and look at our assessment findings, right? So we have a 55-year-old female. She presents with swelling and heaviness in her legs, particularly in the afternoon. She has noticed that her lower legs are often discolored with a brownish hue around her ankles. She stands for long periods as she is a teacher, but on exam, you note bilateral leg edema and varicose veins. She does not have any significant pain, but states her symptoms are worse by the end of the day and they improve with leg elevation, right? All right, y'all. So, two things. One, the varicose veins we see as a venous issue. We can tell she has the heaviness, the swelling, the edema, the brownish hue around her ankles. Y'all, this is classic for B, CVI, chronic venous insufficiency. But some things I want you to think about. Outside of, my piece of A-Town Down, Brittany's Brilliance Mnemonics for PAD and CVI also want you to think with PAD, the more that we exert or walk or, require increased blood flow to our lower extremities, they're going to have more pain. That's with PAD, okay? Peripheral arterial disease. So that's when you're going to hear like, when I'm walking, I have pain, or they may have claudication. Whereas with chronic venous insufficiency, they're struggling to bring blood back up to the heart. So the more that they are on their legs, they start to have swelling, they may feel heaviness, but when they elevate their legs, which can aid in helping the blood flow to the heart, then the swelling goes down, they have relief, right? So these are key indicators also from PAD versus CVI. I'm just trying to tell you some extra tidbits. So if you see it in a question style or in your patient, it'll quickly help you identify one versus the other. All right, and question number 3. A 68-year-old female presents with a non-healing wound on her lower leg. The wound is located just around the ankle and has irregular borders. The surrounding skin is erythematous and edematous with moderate drainage. The patient reports a history of varicose veins and a sensation of heaviness in the leg. She denies any claudication or pain at rest. What condition is most likely associated with this patient's non-healing wound? Is it A, PAD? Is it B, CVI? Is it C, diabetic neuropathy? Or is it D, venous thrombosis? Take a moment and tell me what you got in the comments, y'all. All right, so stemming the question here, she denies any claudication or pain at rest. What condition is most likely associated with this patient's non-healing wound? Again, this is a diagnosis question, so we want to run it back and look at our assessment findings. So we have a 68-year-old female who comes in, has this non-healing wound on her lower leg. The wound is located just above the ankle, has irregular borders, is red, is swollen, with some moderate drainage. The patient does mention a history of varicose veins and a sensation of heaviness in the legs. She denies any claudication. Classic for CVI, right? Because what's happening? The swelling, the inadequate blood flow, the wound is struggling to heal in that area, right? um the swelling for where things begin to pool, where the blood is no longer able to come back up to the heart, is classic. The varicose veins is classic, letting you know it's a venous issue. um Also, where it says she denies claudication is associated with what, y'all? With PAD, right? So that helps you to with that differentiation as well. When you hear heaviness of the legs, commonly associated with CVI. So your best answer again is B, chronic venous insufficiency. All right, you guys, I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But y'all know what to do. Y'all make sure y'all meet me back here. And if you need any of the resources that I do offer, everything is linked in the bio of this channel, including my website. But feel free to give us a call at the Nursing Studio at 803-400-6864. You can also shoot a text message to this number or shoot us an email to the Nursing Studio, the number 1 at gmail.com. Also, I always say if you're looking to book any of my one-on-one sessions or my custom packages or plans, I always say either call, text, or email, as I prefer to speak with you first to gauge what you truly need to make sure you're booking the appropriate session type, okay? All right, you guys, y'all know what to do. Y'all make sure y'all meet me back here. Happy studying. Bye, y'all.